Well, hey guys, welcome to the Bald Truth Special Edition Live Hair Transplant. Obviously, you kind of see what's going on already. Sorry for the late start. We are here with IAHRS accepted member Dr. Sara Wasserbauer, who um, has been gracious enough to allow us into her OR, and she is performing a surgery on a guy who's actually had a previous hair transplant. His name is Greg Adler. He's an attorney, and he also happens to be a fitness model. And we thought we would kind of bring you in live to see the entire process. You know, we've done several FUE procedures live, and a lot of guys are kind of struggling with, um, the idea of what direction they should go in. A lot of guys who write the Bald Truth and the IAHRS, and of course the American Hair Loss Association, are they read a lot about the strip procedure. They're concerned about the linear scar associated with traditional strip harvesting, and obviously people are kind of moving towards what's considered less invasive types of surgical hair restoration. However, the traditional strip procedure is still being performed every day with tremendous success. And, Greg actually had the option to choose an FUE or a strip, and he decided to go for a strip. Now, Greg, while I have you there, can you hear me?
I can hear you.
All right.
Can you
Hey, listen, yeah, I can. Thanks a lot for allowing us to view this. This is, for most people, it's a pretty intimate situation. And I think it takes a lot of balls, first of all. And I really appreciate the fact that you're putting yourself out there so that other, prospective patients can kind of see what you're dealing with.
Sure, I'm happy to help. That's the idea behind this, is that, whatever I can do to help make people feel more comfortable getting it done or answer any questions, I'm happy to do it.
Well, listen, and I appreciate that. So you've already had a previous strip procedure, and you had the opportunity to, obviously, you've been through the process. You know what the downtime is like. You know what the healing is like, and you also know what the results are like. I'm sure you've done a lot of research. I mean, you're an attorney. You are a Mensa member, so you're obviously a very intelligent guy. And you've been able to kind of weigh the different procedures out for yourself, and you chose to have another strip. Can you tell us why you made that decision?
The strip is what I wanted to get done before. I think the technology was a little bit different back then in terms of FUE. And so you couldn't get as many out through follicular unit extraction as you could with your traditional strip. So 5 years ago when I was doing mine, that seemed like a better way to go, because my one regret was that I didn't actually get it done as soon as I should. I should have done it a couple of years sooner than I did, and I waited, and that was my only regret. Now, there's still that disparity between FUE and your normal strip procedure. And so for me, because my last strip procedure went so well, pain was minimal, downtime was minimal. I think I was back in the gym within 10 days, doing normal activities. There's no reason not to do it that way when I haven't had any problems with it.
And turn your head towards me, you can see I don't know if you can see a little bit of that. That's his previous scar. And people always ask me, if they do a second procedure, what are you going to do? You go a little bit above and a little bit below. And so we're going to take that scar out today. Because even though it's a nice scar, it's about 1 millimeter. It's still not my best, and I feel like I can do better. So that's why I'm go versus.
And I don't mean to cut you off. I think that's an interesting point that Greg made, was that, he had a good experience with strip. A lot of the guys that are on the message forums who have had previous strip procedures, who are posting about their experiences, a lot of guys that spend time on the forums are not necessarily happy with their procedure. And I try to let people know, there are thousands of people who have really positive results and a positive experience with traditional strip every year. And they are not going on the message forums complaining about their widened scar or, issues with, nerve issues and numbness and things of that nature, which obviously can always occur in any type of cosmetic surgery. But, I thought this is a really valuable, broadcast, because so many guys who, are considering surgical hair restoration believe that the only option they have now is to go for follicular unit extraction. And listen, I'm a huge fan of FUE, and frankly, I really kind of helped to introduce it to the U.S. and to Europe through Dr. Ray Woods. And initially, when I started to talk about it, all the doctors thought I was insane. I certainly believe that it's a tremendous procedure. This is the way that the industry is evolving. But I just think that it's really, this is very powerful just to kind of show people that, what, if you're in the right hands and you're not concerned about shaving your head, you want the most bang for your buck. You want to make sure that you're going to get a relatively large session and get the most hair that you can. For many people, strip is the way to go.
And with that, Spencer, what we're going to do next is we're going to lower this chair down, turn it into a bed, and we're going to let Greg lie face down like he's about to get a massage. We're not going to give him a massage.
Come on.
But I know, we're such a team. But that way, and then if we're going to go ahead and get started, and you'll get to see what we actually do.
Well, great. And while you're, obviously going through the process, just take your time. I want you to concentrate on Greg. So I'm not going to ask you too many questions, but if you can just explain what you're doing while you're doing it, that'd be great.
I'm fine with giving you the play-by-play. If I have to go silent and you ask me a question, I just won't answer. I'm not trying to be rude. I'll be concentrating.
No, I appreciate that, and I'm sure Greg appreciates that as well.
All right, Greg, your face goes in the toilet bowl. Toilet seat.
Thank you.
And tuck your chin down, like you're looking at you. There you go. All right, we're going to put a pillow under your legs. Go ahead and hang your hands there, or you know what? You can also put them back along your side. You want to put them back along your side? I'll try it and see if you like it better. It's right there. How's that feel? Is that more comfortable?
Yeah.
We'll put a blanket on you if it gets too warm. Go ahead and let us know. Eric, can you give me that blanket right behind you? Wait a second.
I'm actually warm.
You're warm?
Yeah.
Would you like us to not use the blanket then?
I think I'm okay for now.
Okay. How's your low back feel?
Good.
Okay.
All right.
Just so you guys know, this is, to my knowledge, this is the first live strip procedure done on the internet. Obviously, there have been other hair transplant procedures performed. We, stream live. We did the first live hair transplant procedure back in 2009. But, usually they don't kind of show you the full Monty. Today, this is exactly what we're going to do. We're going to show you exactly what goes down and, how the procedure is performed. And, some of you guys may be a little squeamish. And if you are, then maybe, this is the time to kind of, surf the internet a little bit. But I think that most of you guys are going to be extremely impressed at just how, and I think it's a relatively, and you can correct me if I'm wrong, it's certainly not a simple procedure. It has to be done in a very specific way, but it's a lot more straightforward than I think people realize.
Spencer, you didn't tell me that no one had ever done this online before.
No one has ever done this online before. You're the first.
Surprise, surprise, surprise. So a lot of people anticipate that surgery like this is totally sterile and that they're going to be knocked out like if they're going to get their appendix removed or something like that. But this is actually very shallow surgery. It is not very deep. And Greg, you're still awake? Yes.
Yep.
Can you hear him?
Yes.
And Greg, I'll ping you and make sure that, if you want to fall asleep, you can fall asleep. This is boring. He's kind of laying face down and he's probably getting sleepy because it's dark in there and you're like about to get a massage.
I'm pretending I'm getting a massage.
He's pretending he's getting a massage. But it's actually very, very shallow and you'll see. We can ask Greg if he's feeling anything, but Greg, what would you say so far on a scale of 1 to 10 your pain has been?
1.
One.
Just a little needle injection. So
a little prick?
Yep.
We like to say that if you feel a prick, it's just Eric who's behind the camera. It's a little
You know,
prick.
we have a couple of questions from the chat room. One question is, you know, how many grafts are you do you think you're going to be able to get out in this session?
So what I did is I measured his elasticity and his density. Sorry, that's our autoclave. So you know everything is sterile by hearing that noise. Greg has an old scar. If Greg did not have this old scar, he'd probably get a couple hundred more grafts, but we want to take out this scar so we can make it I can do better than this scar. This is my scar, but I can still do better. It's 1 millimeter by about 15 or 16 centimeters, and it's not noticeable unless he cuts his hair down to like a 2, but I feel like I can do better. And so we're aiming for as many grafts as possible. We'll probably get a couple hundred less than if he didn't have this scar, but we'll probably get, I don't know. My initial estimate was 22 to 2,500, but I typically surprise myself and get a couple hundred extra. So that was my initial estimation.
And how many grafts did he have? How many grafts did he have in the first procedure?
First time, I think it was like 1,600. And we filled in his temple. You can see, we'll put up his shots so that you can see how his hairline has aged with additional loss. But we filled in through the center. We didn't just fill in his temples, which for those of you who are considering surgery at all, is the wrong way to go. Do not fill in just your temples, because then you're going to be left, if you have any additional hair loss, you're going to be left with nothing in the center and 2 little horns of hair on either side, and you'll be locked into having to do surgery.
The guy from No Doubt.
The guy from No Doubt.
Well, that's exactly what a doctor in New York wanted to do to me when I was 22 years old, and I thank God that I had the wherewithal to kind of just step back and say, you know what, this is not for me, because I was lucky enough to maintain a decent hairline, but it did recede significantly, and I would have had these 2 horns of hair.
A little sharp pinch
A little pinch here.
over on the right side. Ow.
I'm sorry. Anything more now?
And if you can explain to the audience what you're doing, that would be great.
So we just did a very shallow incision right here. It's about 1 millimeter or 2 deep. And now I'm going to make the top incision above where the old scar is. You feeling anything, Greg?
Now, is there a way that Eric can get in a little closer or no?
Absolutely. How close do you want to get, though?
Let's see what we got. People want to see what we're doing. That may have been a bad move because we just
There's some
froze.
space though in here too because I need to work. So let me see what I can do.
All right.
The camera will adjust as we get in closer here with the light. Sorry, Greg.
Okay. I'm all good.
Let's see if we can get it.
That's perfect.
Is that
That's
better?
great. That's great.
Oh, we'll go this way. Here we go. Lock that down. Is it white now, or you guys got a good view there?
It's whiting out a little bit, but it's fine. Basically what we want to do is we just want the viewer to be able to see what Dr. Wasserbauer is doing, and I can see the strip clearly.
Okay.
And I just asked Greg what he's feeling, and he said just pressure. And somebody's calling. Who is it? So basically now, I made the incision very shallowly on either side. Eric quit playing with the phone.
Trying to turn it off.
I made the incision very shallowly on either side, and I'm just tugging, and the hair separates itself. This is how you don't get transections and lose hair. So anyone who's considering an FUE, there's a transection rate that you have to consider. This has almost no transection rates, and as a matter of fact, Greg has a really beautiful scalp. I'll show you in a second how gorgeous his hair is here. And you can see the scar is right at the very center. Hold on a second. There's one little bitty graft.
Yeah, I don't even want to ask any questions at this point. I just want you to concentrate on what you're doing.
I am.
No, I know you are. I don't want to interrupt that concentration.
I just didn't want that graft to be wasted.
No, absolutely.
He's got like gold.
So the guys that are just tuning in, just so you know, we are watching IAHRS accepted member Dr. Sara Wasserbauer perform a traditional strip harvesting procedure on a guy who has had a previous surgery. He had the choice to either go FUE or go FUT, and he decided to go FUT because he had such a good experience with his first hair transplant procedure. And I think that really says a lot. You know, what we read online, and again, listen, I am a huge proponent of the less invasive procedures. I really pushed for FUE in the U.S. and in Europe, and it is the way that the industry and the field is evolving. Dr. Wasserbauer performs quite a great deal of FUEs, and we actually did the first artist FUE procedure live. Did we do it live, or was it, I think it was recorded, I forget. But anyway, you were part of the, you were actually the clinical investigator for the artist, right?
Me and Dr. Harris were the primary investigators. There's another Dr. Berman, who also I think was part of that as well. But yeah, the majority of the trial was done between me and Dr. Harris. Yeah.
So, I mean, you are a person, you're a physician who does both FUE and FUT. And in your practice, I mean, would you say that most guys are coming in now asking for FUE, or is it still about 50-50?
You know, most guys are coming in asking, and then, you know, we discuss the pros and cons. And we figure out what's actually right for them instead of just listening to the hype.
And I think that's a really important statement, because there's this dogmatic attitude amongst the, you know, in the online world. And I really think, you know, none of these procedures are one size fits all procedure. And that's what prospective patients have to understand. You know, when we have like, you know, one of the guys who are really well known online, like Joe Tillman from Hassan Wong, or Spencer Stevenson, who works with Dr. Feller and some other doctors now, they both had multiple strip procedures and they've had FUE procedures, and they both say that, you know, they have no problem going back to have another strip procedure if they were going to get more work done. And I think that says a lot. You know, these are experienced hair transplant veterans who've done both procedures, and you know, I really just think that it depends on the person, and it depends on what their goals are.
So, for those people who want to see, could you hand me a large medium one down? So I just want to show how beautiful the back of his scalp is. It's just so pretty. So you can see, I know, this is how you know I'm a nerd, right? Is that how beautiful this is. So you can see, I don't know if you can see on this side, but all the hairs, none of the hairs are transected. And that's because we were pulling at it. That might look odd to somebody who doesn't know what the heck is going on. But when you pull at tissue instead of cutting tissue, it's much gentler. And the tissue can heal. It can separate along its natural planes, and it can heal a heck of a lot better. And then I just want to show you how pretty his vessels are, because we tumesced. He's got a beautiful vessel here. Nothing was cut. And people ask, oh, do I bleed a lot? This is it. This is it. And I shouldn't say this, but Greg had a little bit of alcohol yesterday, which he's not supposed to, but I gave him the go-ahead, so it's my fault. And even then, it's looking really, really nice. This is not significant bleeding. So can you see that, Spencer?
Yeah, just
Yeah,
across the line.
we could see it great, and it was Cinco de Mayo yesterday. So I mean, come on.
I know, that's why I didn't. It's not like I can get upset. Everybody, you gotta be realistic as a surgeon. So I'm getting rid of my sharps, and what my staff is doing right now behind the scenes is they've taken that piece of tissue, they've measured it, and now they're looking at it under a microscope. And what I'm going to do is I'm going to start with a trichophytic closure above and below, just getting the hair out of the way. And you'll see me do this from time to time. This is probably going to take about 15 or 20 minutes for me to do. But the steps are, number one, remove every tiny little spicule hair you can possibly see. This is where it helps to be anal retentive. Number two, do the trichophytic closure above and below. Those two aren't in sequence. They just kind of go along. And then number three, I'll put in some subcuticular sutures that'll be underneath the skin, and they'll bring the skin really nicely together so that there's no tension on the wound.
Now, maybe you could explain to our viewers and listeners what a trichophytic closure is.
So it is removing a little tiny strip of skin from the top and the bottom of the incision. And then when the two sides are brought together, the hair will grow through the scar.
Now, let me ask you, what percentage do you think? I mean, I've seen a lot of trichophytic closures. Sometimes, I mean, I guess it depends on how they're performed, but is
it's the upper, the lower, is the both. So there was a really nice article, and people can look this up online. These articles are not rocket science. You can find them, and you can read about what the surgeons read about. And the trichophytic closure is done best when it's both edges, upper and lower. Some doctors do one, some doctors do another. That's why they call it the practice of medicine. That is entirely up to them, how they decide to practice. But it has been shown that upper and lower, unless you're talking about different special circumstances like scar or insufficient elasticity, then, as a doctor, you have to make a judgment call. But
so to kind of paint a picture, basically you're beveling the edges, right, in a sense.
The edges, yes. Thank you for that word. That's precise. And if you ever see a surgeon with shaky hands, it means they haven't had enough coffee that morning.
I actually did know a surgeon with shaky hands, and I went to his office to interview him. This is early on in my career, and this is when we basically first started the IAHRS. And I saw his hand shaking when I shook his hand, and obviously I couldn't bring him on board. But I'm thinking to myself, don't patients check out the doctor's hands? That's the first thing that I would ask them. I would ask them to see their hands.
You know what? It's interesting because I know a doctor with shaking hands too, and when he's in the moment doing the surgery, a different part of his brain kicks in, and that shake goes away. So
I guess it's kind of like people who are stutterers who could sing.
Right. And exactly. Greg, you doing okay?
Happy.
Did you hear that? Spencer,
Now,
did
you
you
have
hear
a couple. What was that?
what Greg said?
What did he say?
He said he's happy.
Oh, that's great. Well, so basically, you gave him some sedatives, and you obviously anesthetized his scalp. What kind of medication is he on?
A little bit of Versed and a little bit of Valium, and of course antibiotics.
Well, that'll make you relax.
That'll make you happy.
Yeah. So we have a couple of questions in the chat room, and
we give IV tequila.
What about there's a lot of clinics now who are especially the guys in Canada, Victor and Jerry Hassan and Wong, who promote the idea of scalp stretching exercises before you go in for strip surgery. Do you guys do anything like that, or do you think it's necessary?
I don't think it's necessary. I think it helps in certain cases of a tight scalp. There is also research on that front, and it can help. But, if you have a tight scalp, you have a lot of other considerations, and that might not turn you around. It might get you a couple hundred extra grafts. It depends on, are you a bald guy who's going for as many grafts as possible? To fill in the whole top of your head, or you Telly Savalas and you want to go to a flock of seagulls. So it just depends on the individual patient, and some patients already have an elastic scalp, and if they do that and increase their elasticity, they might have some additional stretch back. So it totally depends on the patient. You don't want too much elasticity, and you don't want too little, I guess. So it
Now,
does help.
how can a patient know whether or not they have a tight scalp? I mean, obviously you would check it out, but I mean, can a patient tell himself?
Yeah, they'd have to shave a little area at the back of their head, 5 centimeters by 1 centimeter. And then they have to get somebody to make 2 marks on their scalp about 5 centimeters apart. And then they have to get 2 of their friends, one to hold up a ruler and the other one to push the 2 sides of the skin together.
Wow, that's a process.
Yeah, it is a process, but that's one of the reasons why the most precise measurements are actually made in the OR before the surgery happens, because most people don't feel like leaving the doctor's office with a little part of their head shaved. So right now what I'm doing is I'm placing one of the subcuticular sutures. You can't see on this side of the head, but this suture is going to hold the skin together so that Greg doesn't have a ton of tension on his wound.
Now, guys, I know most of you guys are watching this from work, so there's a good chance you can't call in. But if you want to call in, you can call the toll-free number, which is 888-659-3727. You can ask Dr. Wasserbauer questions. You can obviously ask Greg, who is the patient, questions once he's turned around. You'll be able to hear him a little bit better. And, I know a lot of you guys who are considering surgical hair restoration really want to know, some of the basics. And, you can't read about this stuff online on a message form. It's really best, in my view, to hear it directly from the horse's mouth, speak to the patient who's undergoing the procedure, and kind of, learn from what they're dealing with while they're in the chair. So I think this is a good opportunity. Again, 888-659-3727. And I know that most of you guys who are watching this are probably watching it at work. You may even have the sound off to some degree. But if you can find a minute to call in, feel free.
Sorry, my hands are all sweaty, so I'm out of the picture for a sec.
That's all right. So, Greg, can you hear me, man?
Yeah,
So how are you feeling now?
great.
Yeah, it's interesting when you see the process live, and I have seen it. I've been in the OR and I've seen it. It's really not as bad as I think people perceive it to be.
Yeah, no, it's the imagination is way more graphic than the reality.
And the truth is, go ahead.
People ask me, don't they put you out? And I'm like, no, most of the day you're sitting there watching movies.
Well, I've recently seen some other cosmetic or plastic surgeries being performed, and I will tell you that as far as cosmetic surgery is concerned, using a scalpel, this is probably one of the least invasive procedures that I've seen. Besides, I recently saw a chin augmentation being performed. It seemed relatively, non-invasive, except I'm sure that, they're working, beneath the skin with all the tissues. There could be some damage there. But all in all, I would say that, on the grand scale of things, this is relatively, non-invasive. And, I just want people to see exactly what transpires in the OR. And that's why I think that, this particular live stream is so important. You know what? The FUE stuff is obviously very sexy, and the robotic stuff is obviously very sexy. But this is still, in a sense, the bulk of what goes on in surgical hair restoration. And most people don't want to. Say that again?
It's still considered the gold standard.
And no one is really putting this out there online, especially this end of the procedure. So I'm glad that you guys are willing to do this. And Greg, I just want to thank you again. I mean, you're a real trooper.
Well, I'm happy to help. I mean, I know there's a lot of people out there who've been considering it and have questions, and to whatever extent that this will help them make some decisions about what they want to do, I'm happy to help.
I appreciate that. And I may ask you some fitness questions after the show because I'm trying to get back into shape.
Anytime.
What was it? 94, 2004? What were you were Met RX champion 92, 97?
2004.
2004.
My wife was she took a first place trophy in her first NPC figure competition.
Yeah.
In 2005. She used to compete a little bit.
Good for
So
her.
when she was competing, I was in a lot better shape. But
Yeah.
I'm getting. Say that again.
Does she do the cooking?
Yeah, she does most of the cooking. Yeah, so that's the only reason why I'm not 250 pounds. But I love to eat.
I love to eat too. So you can see, well, I don't know if you can see on that side yet, but maybe you can get an idea that, the skin really comes together. You think it's a huge open wound. But it's just because the skin's very stretchy.
Right.
It looks a lot worse than it actually is.
Now, for the guys who are just joining us, we're going to repeat some of the questions in the chat room. And somebody else wants to know, why did you choose FUT over FUE? So, maybe you can explain that again, Greg.
The amount of follicles you can transplant in one session with FUT is much more than you can go with FUE. So if you want to come back multiple times for FUE, you're free to do that. I would rather, because I had a good experience in the past with FUT, just get it done that way.
That's such a common response, and the guys who are, again, and I'm going to repeat myself, who frequent the message forums and kind of are hyper focused on the technical aspects of the surgery, and are hyper focused on the bad experiences that are posted online. Really, they're not thinking in the same vein that you are. You had a good experience, and there are thousands of guys who have good experiences every year in the right hands. And I think that is so important for the hair loss consumer and the prospective patient to understand. I am not here to promote one surgery over another. I am a huge proponent of FUE, but I think people just need to make really educated decisions and understand that they shouldn't just be focused on the hype. They should be focused and understand the science and the reality of the end results.
Right, and you have to just keep your goal in mind, which is if you want to try to get maximum density, you're probably going to have to go with FUT, because FUE you're not going to be able to get it. You're going to have to go back multiple times. And I would
with that said, there are guys out there. There are practices who are doing, larger sessions, larger and larger FUE sessions now, where you can go and you can get a 3,000 graft sessions in the right hands, and I've seen some incredible results. However, we still don't know. It really depends on how the grafts are being extracted. We don't know the exact transection rates. I mean, everybody kind of has their individual studies. So, some doctors will say it's 10%. Some doctors will say it's, in their hands, it's 6%.
Right.
Some doctors will say
it's not codified. So, and
right.
there's no checks and balances on it. I mean, the IAHRS has a code of ethics, but nobody is policing what people say their transection rates are. I post mine, but that kind of probably makes me a target. And at the same time, go ahead.
No, go ahead. You finish your thought.
Well, I was going to say, pretty much anybody who is good at FUE can get numbers, but this is not a numbers game. This is, I think there's an inappropriate concentration on numbers of grafts that you get out, because if you go into the areas above and below the donor zone where the hair is permanent, you're going to end up taking hair via FUE. Your numbers are going to look good, but that hair is not going to last. So you transplanted temporary hair, and you're not doing the patient any favors by doing that. Plus, when that hair starts to get lost later on, let's say the patient doesn't decide to go on Propecia for whatever reason, or doesn't use Rogaine, or I don't know, has a major stressor in their life that accelerates their hair loss, you're going to be able to see those little tiny dot scars. Now, I love FUE just as much as the next person, probably more. I do a ton of it, but you have to be careful with it. I think that because hair loss is so emotional, people fall into the trap of, I want to get the best thing, this is the newest and latest thing, and just kind of getting on the bandwagon.
And I agree with that. And, unfortunately, the way that FUE is being marketed today, it's really being marketed by a few companies as opposed to just, physicians themselves. And we have the companies who are making these devices who are promoting their devices as kind of like a procedure, for instance. And, the problem with that is, there is a lot of confusion in the market. And people do think that they're getting the next greatest thing if they're using if a doctor's using a specific device. I can't speak this morning. And, the problem with that is, a lot of these guys, especially at least with one device that I know, these devices are being sold to like med spas. They're not being sold to hair transplant surgeons, or they're being sold to plastic or just cosmetic surgeons who really don't have any plastic surgery background. And, they're like there's these per diem techs that are going around the country actually performing the surgery. Patients don't understand that. They don't realize that the end result is based on, how good the staff is, how good the surgeon is, and how much experience the staff and the surgeon have. So it's not about the device. It's not about the next great thing. It's about seeing results, speaking to patients if you're considering this procedure, and really understanding the entire scope and possible pitfalls of whatever procedure you choose.
Yeah, knowing what is proven and what is going to be really best for you as the patient.
So we have Mike from Canada. Go ahead. I'm sorry.
I was going to say, sometimes that means if you're talking to a good surgeon, sometimes that means they're going to talk you into a lesser procedure. And part of the problem is when they've gone to multiple docs, if there's a doctor who said, oh, I can get this much for you, but, another doctor doesn't think that's enough or thinks it's too much, you end up looking a little weird, and it seems like there's no coherence in the industry, when really what's happening is it's just different doctors' opinions and different doctors' experience, which is why the experience level matters so much.
I try to, create some sort of, just cohesive a group of doctors, obviously, who kind of have the same philosophy. And I think as far as the IAHRS is concerned, most of the doctors have a similar philosophy. But like you said, everyone does what they do in their practice based on their experience. And, I think that it does become extremely confusing, especially for the younger patient. The older guys seem to really, I think, do their due diligence and really take their time and kind of understand that a lot of what you see online is hype. See patients, speak to guys who have had the procedure done, really kind of feel your doctor out. But the younger guys kind of believe the hype. And they are flying all over the world to have cheaper procedures. They're flying all over the world to have what they consider to be scarless procedures without really... Well, there are a couple of guys out there that seem to be creating really minimal, non-visible scars. But the truth is, there's always microscarring, and we really don't know what the long-term results are for some of these guys as far as how great the aesthetic result looks. Most of the guys that I see who are getting these type of procedures done, they're getting very small sessions. They're keeping the hair very close cropped, so they're concerned about any potential scarring. So I kind of get that. But you just said something interesting. You said there's no scarless procedures, and I'm a guy that has been saying on my show for the last 15 years. I can't believe how long I've been doing this. That once you're cut, you're cut. whether it's FUT or FUE. There is no such thing as scarless procedure. So a doctor in New York, who is a member of the IAHRS, and you probably are aware of him, his name is Dr. Carlos Wesley. And he is actually going to be presenting something at the San Francisco meeting in October that, at least from what I've been able to see, it's pretty amazing. And it does seem to be kind of like a scarless FUE. Do you know anything about that?
There's a couple of different people out there working on that kind of stuff, but I can tell you I've done FUEs on patients and gone back later and done a strip procedure on them in the exact same area, so I've been able to look under the surface, and we just took pictures. There's scar. It's underneath the surface sometimes, but there's definitely still scar.
Yeah, and that's the thing.
So,
I mean, even if you're going in... Well, just so you know, I mean, because the patent is out there, it was posted on Bald Truth Talk, and it was posted on a couple of other sites, so I'm not saying anything that Dr. Wesley would not want me to put out there. But, basically he has created this device that goes, it's kind of like almost like an endoscopic FUE, which it's pretty interesting. It really is. So, I am going to be, keeping my eye out on that, and I have a feeling a lot of the doctors are. I spoke to a couple of other guys who are really interested in learning more about it. So, I mean, that's something that, maybe when you come back from the meeting, you can tell us your thoughts on that.
Yeah, I'm looking forward to any and all things that improve. But having been in this industry as long as you've been broadcasting, I'm not going to date myself and tell you how old I am, but it does it does make sense for a surgeon to take their time and evaluate and see what the results are, because everyone jumps on these bandwagons. I mean, right now it's FUE. Next year it'll be, ACell. After that, it'll still be cloning, because cloning's been, the holy grail for like 10 or 15 years, but nobody has the answer yet. And as soon as they do, I'm all for it, but I'm probably not going to be the first person on the bandwagon, because I've seen too many screw-ups, and I'm not going to put my patients at risk.
Well, I agree with that. I think that's actually, a real common sense approach. And I tell all patients, you don't want to be the guinea pig. I have the famous Joe from Staten Island, who has been a regular caller since day one when I was on WABC in New York, is, he's always asking us about...
Reverb on you there, Spencer.
Can you hear me now? So he's always asking about the latest and greatest. And I always tell this guy, listen, I can send you anywhere you want, but I do not want you to be the guinea pig. And, I do think a lot of doctors do jump on things. We have a question in the chat room about ACell and PRP. What your thoughts are in using ACell and PRP in surgical hair restoration. And that a lot of guys did jump on ACell and PRP early on. Are you experimenting with it, or do you use it in your practice at all?
No, we do use it. We actually did one on Friday, as a matter of fact. My experience is pretty good. I use it for a lot of my tougher cases, which means that there's not a lot of chance of getting any result. And in some we get results, and some we don't. From what I can tell, and remember, these are very isolated. There's not a lot of controlled trials. There's just a lot of hype, which is probably why it's so exciting, because we don't have reality. Is that if you use it in a scar, it makes the scar better. It's not going to rescue a bad scar, but it can improve one. It definitely seems to help those who have earlier hair loss than later. So if you're a 45-year-old guy who's a class 6 or a class 7, and you come to me wanting ACell and PRP to grow all your hair back without doing a hair transplant, that's not going to do it for you. It's a series of injections, so we know that if you get results, we don't know how long those results are going to last. They might last 5 years. They might last a year. They might last 6 months. It might be something where you have to get serial injections. Nobody really knows. Maybe it's like an antibiotic. You take it once and it turns it around, but I don't know yet.
Well, I'm
definitely
very
helps with
friendly.
wound healing, though, so you can use it within a surgery, or you can use it without a surgery.
I know, Dr. Joe Greco, who is really, one of the main pioneers in PRP when it comes to hair. I've spoken to a couple of his patients, and I have someone in my personal life who goes down to see him every couple of months, who really believes that they experienced a positive effect from just PRP as far as just maintaining their hair. Now, there's a lot of guys online who kind of took the lead from, when I had Joe on the air a few years ago, and just, about, seeing what's written about PRP online. And they went down there and they didn't get great results. But there are a lot of people that, Joe will send me, images, every couple of months, who seem to be getting really good results. And there was a study that just came out the other day. I forgot where it was published. Basically, it was showing how it had a really positive effect in alopecia areata, which, I think that's pretty compelling if they're able to grow hair on patients with alopecia areata.
Is a different disease.
Right.
That's a different process. So, I mean, one's autoimmune. There might be some inflammation in androgenetic alopecia, but it's probably not the degree that it happens in alopecia areata. I'm all for it. Look, I'm excited. If we could just treat people with injections, I would happily abandon my surgical practice, although I really love to do this. I just want what's best for my patient, and if we could get better results, I'm all for it. But I want to make sure that those results are proven before people start to, shell out a whole bunch of money on an experimental procedure that they think is going to save them. And I just don't want to go down that road.
Well, and I appreciate that. Listen, I see guys who are flying to India to have these, so-called hair multiplication procedures performed because they're reading about it online. And that just kind of speaks to the desperateness of hair loss sufferers, especially the younger guys out there. We don't want to stifle the information.
There was mesotherapy. People were flying to Brazil. And some people get improvement from mesotherapy, but nobody's done a trial where it's just the mesotherapy alone. Sometimes they go in for mesotherapy, the guy puts them on minoxidil, which is Rogaine,
right,
and they seem to get these good results. Well, what of those results is the mesotherapy, and what of those results is the minoxidil? It's going to be impossible to tell unless somebody does a really good study.
Oh, yeah, listen, I know a guy who's really famous for mesotherapy in New York who does it for everything from, cellulite to hair loss. And I cannot honestly say that I know a single person who had a positive experience from mesotherapy, at least who's contacted me about it. I think, some cases people think they're having a positive, result, and then it kind of wanes and they continue to do treatment for a while and then they just stop. Meanwhile, these doctors are charging a significant amount of money. I mean, the rates are pretty high, and they're not making any promises. So they keep getting new patients, and they're able to maintain their practices that way. And I think it's unfortunate, but that's just the nature of this industry.
Yeah. Yeah, you get a lot of people who will walk in your door if you're in hair, and they will walk in your door and they will say, "I'll pay you anything to put my hair back." And as a doctor, you have to, you want to pay off your medical student loans. But you got to remind yourself that you are in this not for yourself. You're in it for them, and you have to do what's right for them in all cases. And if you don't think it's right for them, you can't do it. Much as you want to try.
And I think it's important that you said that, if you were able to cure or effectively treat people's hair loss just with injections, that you would go that route. There's a lot of guys who, and I see this posted all the time online, that, the hair transplant industry is scared of, the next great thing because they're going to lose so many patients. I try to tell people that's not the case. If it's something like injectables, if it's something that, if there is real hair multiplication out there, then everyone who is currently performing surgical hair restoration is going to evolve their practice in that direction. And frankly, if they're able to offer...
Yeah, we're not in the practice of doing hair surgery.
But, as far as, just the money, and everyone's talking about the money, I try to let people know. Yeah, I'm here. Can you hear me?
Spencer.
Can you hear me?
Yeah, no, I can hear
I'm
you.
here.
Yeah.
Okay. As far, and a lot of these guys are just talking about... Yeah, we're having some Skype issues. Why don't you finish your thought?
One is that you sound like Robert Downey Jr.
Okay.
I don't know if anyone's ever told you that. In Iron Man. I'll give you a good one. And then the second one is I forget.
Okay. Well, I appreciate the compliment. I take that as a compliment. But what I was trying to say was there's a lot of guys out there who are frequent, and I say the forums a lot because there's so much. I mean, if you look at the traffic from baldtruthtalk.com when we started just 4.5 years ago to where it is today, all of the forums in a sense are growing exponentially. But baldtruthtalk.com is currently the most trafficked hair loss website period in the world, and it just shows how many people are really trying to do their due diligence and researching hair loss, and they get involved in the message forums, and you see kind of the way people look at the hair loss industry. Some people who've had positive experiences will obviously look at it in a positive way, and those that may have had negative experiences or read the negative experiences continue to perpetuate the negativity about the industry and those who are involved in the industry. Now, I was the first to come out swinging and talk about all the crap that goes on in the industry. And, I took a lot of flack from people in the industry for many years. And basically, I still say that for the most part, and this is not a popular stance, I still believe that a lot of people in surgical hair restoration are currently not doing it to state-of-the-art standards. And I believe are not putting the patient's best interest in mind. But I certainly don't believe that doctors of your caliber and other guys who are involved with the IAHRS are trying to hold back the progress of hair restoration because they want to keep their practice going with surgery. So I just thought it was really great that you said that, because I want people to know that as this thing evolves, the good guys are going to evolve with it.
Yeah, my husband just got his MBA, and one of the things he studied was, I am not in the hair surgery industry. I'm in the hair restoration industry. However I can restore hair, I want to do it. If it turns out to be injections, hey, I'm a doctor. I can do that.
That's right.
Great. That doesn't threaten me. I'm so excited. Let's do it.
It also will cut down your staff. It'll cut down the time, and you could earn just as much. And I don't think that people understand that.
Happy patients. I'm in the happy patient industry.
So I have a question from the chat room. A lot of people, there's a group of doctors who think that closures need to be done with staples. And then there are people who are obviously using sutures. You choose to use sutures. Why do you make that decision? What's the reason behind that?
Because I'm a little nut about my scars. So yeah, staples, if you have, it's an individual doctor decision. I am pretty proud of how nicely I sew. I mean, you could get out a ruler. Somebody hand me a ruler. You get out a ruler and measure in between, and I'm doing this, completely. And you can measure, and these stitches are almost exactly within 1 millimeter of each other. So I'm pretty darn proud of how well I sew. And this turns out to be a nice scar. And when staples are used, and I've used staples, I've been in practices that use staples, they end up with a little dot above and below. And even though it can be a nice scar, and it hurts the patient when they lay back on it. So mostly I changed for patient comfort. There are some patients who react to suture material. In those cases, you absolutely have to use the stainless steel staples. And there's some doctors who really feel like they get better results with staples. If you feel like that and you're one of those doctors, more power to you. In my hands, sutures are what works best for me.
Well, I had a hernia repair years ago when I was like 21 years old, and they closed the incision with staples. Not only was it extremely painful for me, but obviously that's a more sensitive area probably. I still have those little white dots.
Yeah, above and below. They look like reverse train tracks. I had a C-section, and the guy was about to use staples, and I was awake. No! I wouldn't let him. I made him put in, and I said, you need to sew as nicely as possible because I'm going to grade you when I get, as soon as somebody lets me up off this table, gosh darn it, I'm going to check and see how well you did. I'm like a first grade teacher.
Well, I think that I'm glad that you were awake, that you were able to kind of guide this doctor, because you would have been left with a less than optimal scar.
I would have gone back. Well, knowing me, I would have gone back and made him redo it. All right, so I'm going to show you something else that we're doing here. that if there's any doctors watching, they can learn from. So there's a new product out called, well, I'm not allowed to say, they didn't pay me, so I'm not going to say what it is. But it's basically a longer acting anesthesia. And so what I'm going to do is I'm going to inject the back. Greg has a lot of muscle tissue. I bet you probably saw that. And so he metabolizes, in other words, breaks down the anesthesia really quickly. And so what this is a longer acting anesthesia, but it can last up to 72 hours. So he's already anesthetized, and what I'm going to do is I'm going to inject this along this suture. Thanks, Rox. I'm going to inject this along the suture line so that when he goes home tonight, he really doesn't have any pain. And this has really been a boon for a lot of our patients. They come back the next day, they're like, I didn't take any of that Vicodin you gave me to go home with.
Well, they could just take it for fun. They don't really need it.
Right. Whee! They'll save it for later. They'll do it on Cinco de Mayo next year with the tequila. So now Greg's not feeling any of this. Greg might be asleep. Greg, are you with us?
Yep.
So Greg came back from a short nap. Just kidding. And so you can see that, there's no shaved area here. People always ask, is it shaved? And then the other question I get is, will that hair grow back? And the answer is yes. That hair that we took out is going to grow back, but it's going to grow back on the front of your head.
Feel that one.
You felt that one? I went a little bit low because I wanted to make sure that you get this area really numb. I'm sorry. Is it still burning?
Mm. Mm.
That one might be too. That's right in the area of your nerve.
So, guys, if you're just tuning in, you're watching IAHRS member Dr. Sara Wasserbauer perform, to my knowledge, the first live FUT, strip hair transplant surgery, live streamed on the internet. And we wanted to show you guys this because, obviously we've brought you other hair transplant surgeries live. Most of them have been FUE or robotic FUE. Obviously, those are very sexy procedures, but FUT is still being performed every day on thousands of patients by incredibly well-qualified physicians and their staffs with stellar results. And I thought it was important to bring this to you today. And I will tell you this, I wasn't sure, and I guess you guys weren't sure, or maybe you were, but I wasn't sure if we were doing FUE or FUT today. And I was kind of excited when you told me that we're going to be doing FUT and that we're going to be showing the entire process.
Did I not communicate that to you? I am so sorry.
It's okay. I like surprises.
Well, and I also told Greg that if he wanted to change and do, he could do whichever one he wanted. My staff is fine with either one. I have a crack staff. They're the best thing about my practice. Although I'm pretty darn good. I'm just... So I'm adding a little bit. This is just Vaseline because I just want to protect the area. His hair will be a little bit greasy, but you just want to make sure that it holds in the moisture. You want a moist wound, not a wet one and not a dry one. And this just helps the area hold in the moisture and helps it to not form big scabs. Not that it would. You can see it's not really bleeding.
Now, what do you suggest patients do when they go home? I mean, how do they tend to the wound?
Well, I usually give them some, sorry about that, Greg. I usually give them some Vaseline to take home with them. And I say, after you shower, go ahead and put it along the suture line. So I don't know if you can see. I'll just show you right here. This is the sutures are underneath there. You see the stitches? I know it kind of looks a little greasy because I have the Vaseline on there, but the sutures are underneath there. There's one, there's one, there's one, there's one, there's one. And they're just relaxing and hanging out, and you're not gonna really.
I will say, I'll tell you, that's really clean work, Greg.
Thank you.
So I'm looking at it right now, Greg. So you should be pretty pleased with that scar.
I hope so. This is my baby.
I was very pleased with the last scar, so
Yeah, but I can do better. This one's gonna be better.
even better. Went from an A to an A plus.
You know, Doc, I'm glad you're a little neurotic about this because I'm the same way in my life. I mean, I'm a person who takes tremendous pride in my work, and I'm never complacent. And I love to see, obviously, what you're doing is you're actually affecting other people's lives. And the fact that you are so, and maybe neurotic's not the right word, but you are, like you said, you're a little anal about
My
things.
husband's in the room. You can say neurotic. That's fine. He probably feels like I get it out here, so I don't do it at home. I think I told you that the last time we did a live surgery. All right. Well, now here's the point where we're gonna turn Greg over. Hold on. I'm gonna have my camera guy come here so you.
All right.
All right. We're gonna move this back. I'm gonna lower the table down. Greg,
You know when you get a massage and then afterwards your eyes are all unfocused and your face is all squashed like you've been sleeping on your face. That'll be me.
Yeah, and usually I turn out the lights so that you don't get that, oh my gosh, it's so bright in here feeling. But I'm going to leave the lights on.
Okay.
Otherwise it's going to just get dark and Spencer won't be able to see that you really are alive and I haven't hurt you. Go ahead and give yourself a little push-up. I'm going to take this. That's on your butt.
I'm right behind you, Lydia.
Just flip on over. Flip on over and sit up.
They're seeing here.
Sorry. All right.
So, guys, if you can get away from the office, or if you can actually make a call, it's probably lunchtime for some of you guys, or getting close to lunchtime, at least here on the West Coast. Give us a call here at 888-659-3727. Give you an opportunity to speak with Greg and Dr. Sara. And you know what's interesting? You just popped up, man, like nothing happened. You look slightly groggy, but it's like you said, I would get that way just after a massage.
Right, that's kind of how it feels like, just getting up from a massage.
Sorry.
With slightly slurred speech from all the fun Versed and Valium.
Greg is so big, we doubled his dose.
Now, I'm looking at your hair, even though it's a little messed up now, whatever, you still have a really solid looking head of hair. How old are you, by the way?
35.
Okay, I mean, you have a solid looking head of hair. Are you currently using finasteride or Propecia?
Yes. Yep.
All right, now let's talk about that. A lot of the younger guys out there, and to me, you're a younger guy at this point. I'm going to be 48 years old, believe it or not. I mean, to me, believe it or not. And they're really scared to start using finasteride because of everything they're reading on the internet. How old were you when you started, and did you have any concerns about starting?
I read the stats on it, and the people who have side effects, really low percentage, and it's one of those things where you can try it out. If you feel like you have some side effects, just stop taking it. I've been taking it ongoing since 2007, I think, since the first time I came in and saw Dr. Wasserbauer, and I can't say I've ever noticed it growing back, but I've definitely noticed it's either slowing down or stopped, which to me is a success. I mean, if you can halt your hair loss and prevent it from getting any worse, that's a great thing.
Well, I can tell you this, that I've been on the drug for almost 20 years. 5 milligram I take a ProScar tablet several times a week. I do intermittent therapy. I did that kind of on my own during my own experimental phase, and it seems to have worked for me for many years. I'm lucky enough not to have any adverse side effects, and I've maintained quite a lot of hair. I mean, it's been a slow progression. I use a little bit more cosmetic concealer in the back, obviously, than when I first started. I didn't have to paint the back of my head at all. However, I got a significant amount of growth in the first few months and within the first year of using it back in the mid-90s. And I've maintained a lot of hair from it. Finasteride really changed my life. It is because of taking that drug that I decided to write about my experience and write my first book, The Bald Truth, and start this entire career. So for me, it's been completely life-changing. And when I see all the stuff online, and these young guys are so, shit scared, excuse my French, to give this drug a shot, I personally feel they're doing themselves a great disservice because, look at a guy like you who's maintained a lot of hair, even though you're having surgery, you'd probably be a lot worse off. And frankly, I've been able to avoid surgery all these years because of my finasteride use. So, and you're a smart guy. Obviously, you have a very high IQ. You're a member of Mensa. You're an attorney. You're a sharp guy who's made a reasonable decision. And a lot of these guys, I think, are swayed by, I get a lot of crap for saying this, but, by a lot of the, kind of like a core group of people who may have had, or a subset of people who may have had, really bad adverse side effects.
Well, I think, Spencer, it's also the way the question is framed. It's framed as a false choice. Like you have to choose between your sex drive and having hair and looking attractive, and that's completely false.
No, not at all. I mean, I haven't noticed any significant decrease in sex drive that I couldn't attribute to just being a little older, I suppose. I mean, when you're 17, it's going to be a little different than when you're 30. So I haven't noticed much difference there. I mean, I've actually noticed one thing that's nicer, and I hope this isn't too vulgar, but one of the side effects of Propecia is that it actually shrinks your prostate. And so now I have the pee stream that I had when I was like 8. And it's just, and it's like, I'll take it.
Yeah, well, I'm getting to the age where, I have to get my prostate checked on a regular basis. And my urologist is just amazed. And also, he was kind of under the impression, even though he's a physician, he reads all this stuff. He's a hair loss sufferer himself. He was a little concerned about taking higher dosages of finasteride. And, getting to know me more, I mean, there's nothing, and this may be graphic too, but there's nothing more uncomfortable than when you're getting checked out, down there and you have to drop your drawers. Your doctor is asking you about, your finasteride use. So he was really interested himself, and now he's telling his patients about my experience, and he went on it himself. And I guess I'm rambling a little bit here, but I guess my point is there are so many people, even doctors now, who are kind of a little afraid to prescribe the drug because of, all of the lawsuits and all of the stuff that we're seeing online and on television and through the mainstream media. Now, Doc, has this affected your practice at all? Do people come into your practice with this Propecia fear?
Yeah, and it really started, the hype really started about 2 or 3 years ago with this kind of misleading phone survey study. And a lot more data has come out since then. And, I have contacted the number one, he's a male fertility and, kind of male sexual health specialist in San Francisco. And, he was contacted by some of the lawyers who were doing the class action lawsuit. And to him, this was kind of like the way that the silicone breast implant thing happened a while back. It's a very emotional subject. If people have problems, they want to attribute it to, the silicone breast implants. And I think that kind of colors the picture because 2 or 3 years ago, a lot of patients were really worried about it. We said, do what you feel you need to. And what I have found lately is that a lot of people are calling me up and saying, hey, I've experienced a lot of hair loss. I want to get back on it. And there's some alternative dosing strategies. These are off-label uses, but there's some alternative dosing strategies where people can take a half a pill of not the 5 milligram finasteride, but 1 milligram finasteride. That seems to eliminate all side effects. People can take it every 3 days. Some people advocate every 5 days. Some people advocate once a week. And these have varying levels of efficacy, but the side effect profile, every single time it's studied, and it has been extensively studied, if you get anything, and it's a very small percentage who do, it goes away. 2 to 6 weeks. So it's not.
Well, what do you think about this?
It is true.
What do you think about this post? I'm sorry. Go ahead. Finish your thoughts, guys.
It's actually true. I cut back on mine. I was taking it every day for a long time. I cut back to once every other day or once every other third day, and I felt like I had a little bit more energy. I couldn't necessarily attribute it to that, but I certainly didn't notice that when I cut back on the dosage, all of a sudden my hair was falling out. Like when I was in law school, I'd be in the library and start scratching my head, and just all this hair was falling in my book, and I was just like having to brush it away, and I was like, wow, that doesn't happen anymore.
Yeah, that's actually when I first know my short stint at the Pennsylvania State University. While I was studying, I mean, that's when I was noticing that my hair was falling out, and that is, when you're a kid, man, that is traumatic. That is probably one of the worst things that could happen to a young guy. And I guess when you're in law school, what are you, about 23, 24 years old? So you were pretty young when it started for you as well.
Yeah, it got really bad around my second and third year of law school to where it was noticeable, but not something I really thought I had to do anything about. And then right around 2007, when I got married, I saw my wedding pictures and I was like, oh my gosh, my hairline was like halfway up my head.
Yeah, I was I was getting a buying something in a bodega in New York, and I saw myself on the surveillance monitor, and I just flipped out. I couldn't. I was like looking at, who's that guy with the bald spot, and that was me. So yeah, it's pretty devastating, and that's why I think, especially for younger guys, that's why they're so desperate. That's why they're so, they're willing to do anything, go on the gray market and buy all types of topical concoctions from China or whatever to try to stop the progression of their hair loss. What I do find interesting, Dr. Sara, is that a lot of these guys are they won't take the FDA-approved drug, finasteride, because of everything that's written about it and, this fear-mongering, but they're willing to put stuff that they order from China or wherever on their scalps.
Right. And it's kind of, it's weird for me too, because I get people coming in all the time, and they're like, well, I hear that stuff doesn't work, so I'm using this shampoo that I got from India, and I say, oh, okay, what do you need me for?
Right.
I mean, what do you come for me if you think this stuff doesn't work? I mean, if it was working for you, you obviously wouldn't be here. So, okay. Or if it was working, everybody would be using it.
Right.
It's not a big secret.
Yeah, and that's well, there's a lot of conspiracy theories online, and it's just the nature of this game, and that people are really suffering. Guys who are dealing with it, and women obviously who are dealing with it at a young age or any age. We're equipped to deal with hair loss in different ways. When I was younger, I was not equipped to deal with it at all, so I kind of figured out my way through the industry and helped navigate my own way through the industry and decided to do what I do because it was cathartic for me to speak about it all the time. There was really nothing out there where a young guy can go and talk about this issue because society doesn't really allow us to talk about it. So, for me, doing this and writing The Bald Truth was really cathartic. It was more for me initially than being a consumer advocate, and then it kind of evolved into that. But I bought all the lotions and potions back in the late 80s. I probably spent about $10,000 on all different types of treatments, including going to a trichologist and all the stuff that people do even today, unfortunately. Even though we have the science, we know what works, we understand how surgical hair restoration can really positively affect, a change in your life. But people still go these nonsensical routes, and I just don't know why. I guess it's just, there's a sucker born every minute, and it's really, when you go on the internet now, you're just bombarded with so much crap.
Yeah, it's not.
So
it's
tell me
not
what you
clear at all who to believe, right?
Well, that what's funny, when you look up like hair loss treatments or whatever, you're going to find the American Hair Loss Association, usually number 1, number 2, in Google. But people will skip us and go to the product or to the person that is selling an ebook from their basement claiming they've cured hair loss.
It doesn't sound as sexy, Spencer. I'm sorry. It's just much cooler to think that you're gonna solve it with the right shampoo.
Yeah.
And that's exactly it. And then they end up coming back to us after they've either lost some money or unfortunately made the wrong decision by going to some third world country to have a hair multiplication procedure. Then they come back to us and say they wish they would have just read the information that was out there. That's just the way that, I guess it's human nature. As guys, we just want to get fixed. You know, we don't necessarily want to educate ourselves on you know, on the reality. We don't want to read that, you know what, a certain percentage of people just can't be helped, and that with every treatment, there's limitations. People don't want to see that. They want to know, they want to think they're going to get cured. So it's
Yeah, you
unfortunate.
want
So why
to
don't you
believe that.
so why don't you tell us what you're doing now?
So I've been numbing the front of Greg's head. What would you say on a scale of 1 to 10 that was? 10 being the worst.
3.
3.
Just little pinpricks here and there.
Little tiny pricks, like I told you before.
It's one of those things where like you pull out a nose hair, or you accidentally pop yourself in the nose. Your eyes water a little bit. It's not bad, but
It's stinging.
yeah, it stings just a little.
I can
Not
see
bad.
that.
Are you feeling this now?
A little bit.
A little bit.
Now, again, there's a guy in the chat room that just said he wasted 2 years on a product called TRX2, which actually, on Bald Truth Talk message forums, this is one of the most trafficked threads. There's hundreds of thousands of views and replies on this thread. So many guys have tried this product, and you know, it's. I would say, and again, you know, I have no idea, so I don't want the company to send me a lawyer's letter, but to my knowledge, it's had very limited results. But thousands of people have tried it just to avoid the possible side effects of finasteride. When we know that finasteride works for about 86% of the people that try it, will have some positive response. And I think that's pretty huge. Those are pretty good odds.
Right now, we're just continuing to make Greg a numbskull insofar as we can. Not that we
Well, I can
can't,
tell
but
you
that's
that we have a lot of people who are viewing the broadcast. So, and they're, if you, you probably can't look at the chat, but people are thanking you. They're thanking us for bringing this broadcast to everyone live. And
I should have lipstick.
I'm sorry, say it again.
Me too.
I said we should have put on more makeup this morning so we'd look good on camera.
Well, you always look good on camera. Come on.
I'm wearing a mask, Spencer. That doesn't. It's not a great. You look great with your wearing.
Well, I saw you before you put the mask on, so you know.
Okay. I'll take that. I'll take that.
Yeah. So let me give out the phone number again in case you guys want to try to give us a call. I know this is a unique hour for you guys to pick up the phone to give us a call, but we do have the lines open for you. If you want to ask Greg or Dr. Sara a question, it's 888-659-3727. That's 888-659-3727. We're going to go a little longer here, and you know, maybe watch Dr. Sara make the recipient sites.
I'll make the sites. I'm just letting Greg. I'm sorry. I hate hurting my patients. I'm going to let Greg just numb here for another minute and a half, and then we're going to get started. What would you say, Mike?
Press it.
Yeah. Oh, no, sites.
Oh, what size?
Yeah.
They're large, all of them.
Okay. So Greg has, his donor area is thick.
Which is good.
Yes, which is good to have. It's a good problem to have.
Well, I can tell you,
So-
man. I mean, just looking at you, you have a solid head of hair. You really do. I mean, I think it was. I could certainly understand why you'd want more to kind of shore up your hairline. I'm assuming, but you know, right now you look good. It really frames your face pretty well.
So what we're gonna do, I'll let you.
Thanks to her.
This is transplants and this is transplants. So what we're gonna do is we're gonna add some density here, and also in through here slightly because you can't see it from that angle, but I can see it from this angle. There's a lot of loss right in through here. So we're gonna just add some hair in through there, in between the hairs that already exist, wherever I can find a spot, so that if he loses, well, he's never gonna lose this now because he's a graft, but if he loses this through here, that we have something in there. And we actually did a little bit of that the very first time he was here. It was mostly in this frontal zone because that's where I could see the miniaturization. But wherever we see some miniaturization, we're going to end up adding a little bit of hair. And yeah, I'm just going to let Greg numb for a second. And today, you know, there's a lot of different instruments doctors can use to make sites. Today I'm actually just gonna use a needle. A 20 gauge and a 19 gauge needle. So I'm gonna go get those. I'm not leaving Greg alone, but you're not gonna see me here for a second.
Lovely, more needles.
You won't feel these.
Oh.
Ask Greg any questions that you want while I'm kind of getting myself prepared here.
Yeah, if you guys have any questions, I'm happy to answer them.
All right, so let's see what do we have in the chat room. So Greg, so you obviously you're an attorney. So how long do you normally take off work? You told me that you took about 10 days off your training last time. You probably should have taken more off, to tell you the truth.
I probably should. Yeah, I probably should have. But I'm a bit of a gym rat, so I couldn't resist. And I regret it too, because if you go too soon, you'll end up getting some swelling back at your donor area, and it'll feel like you have a pack of hot dogs back on the back of your head. So I want to try to avoid that this time and force myself to take a few more days off. But I was back to work. I was back to work in a week, and most people couldn't even tell.
Now, couldn't you just kind of go in there and lift light? I know that you train heavy, obviously, but couldn't you just go in there and lift light and still get that blood flowing and get that pump and not worry about hot dog effect?
Yeah. Trying not to strain is good. I mean, if you do some really light cardio, if you lift weights lightly, that's fine. But the way I figure it now is, if you can avoid that altogether, I mean, what's the difference in the course of your life if you wait 3 or 4 extra days until the swelling's gone down and you're not going to have any problems? It's not going to make or break you, fitness-wise. So
well, I think a lot of guys, it becomes an emotional issue, and the guys are really into fitness. And listen, I am not one of them. I do work out, but in my younger years, I definitely trained a lot heavier. And there were times when, if I took, 3 days off, emotionally, it screwed me up. I felt like I needed to get back into the gym. And that's what a lot of the guys, I see the guys online writing, asking those questions. And I tell them, dude, if you could take off 4 to 6 weeks, once you get back, you're going to be completely healed. Once you get back into the gym, it's only going to take you a couple of weeks to get back to where you were. And even if it takes you longer than that, like you said, what does it matter in the course of your life?
Yeah, that's a good point. I mean, I took about 2 weeks. I wish I'd probably taken closer to 3. But what I did, knowing this from prior experience, is that I actually worked out for about 12 weeks straight, so that I set it up so that it was time for a break when I did this. So 1 week I was going to give myself off anyway. 1 more week is probably more than I need, but I'm going to take it anyway and just do it right.
Yeah, and I think that's what what people should do. You really got to let your body heal. This is no matter how minor it appears to be, it's still a surgical procedure, and your body needs the time to heal. And this is not an inexpensive procedure. You want to make sure that you're getting, you're really taking care of those grafts and making sure you're not going to get any stretch back from the scarring. So, the guys that are going in there and doing deadlifts or, squats in a month, it's probably not a good idea.
It's also really important, making sure that you're, I think there's a temptation. It's almost like, I'm on vacation, I'm going to eat whatever I want. But you should really try hard to have, clean protein sources, healthy carbs, lots of vegetables, take your vitamins.
Tell me if you have anything.
Okay. Just to help get your body in a situation where it's primed to healing. If you're out eating pizza and ice cream, that's probably not the best thing for you. Try to eat clean, have some discipline over the next couple of weeks, and I think it will help you heal faster.
I think just ingesting the sodium and the hot and the bad carbs alone can stretch the tissues a little bit. And it may seem insignificant, but I would assume that if you are bloated all the time, you get bloated. You don't just get bloated in your face. All the tissues around your scalp get bloated to some degree also. Maybe I'm wrong, Dr. Wasserbauer, but I'm just assuming that by maintaining, like Greg said, a really healthy diet, keeping your sodium levels relatively low and your bad carbs low, that you're creating a much better environment to avoid stretch back from strip surgery.
Nutrition is so much more important than we give it credit for.
Yeah.
So be healthy, And you know what's going to happen is you're going to get somebody posting on your thing, Spencer, that says, I smoke a packet half a day, I weigh 250 pounds, and look at this great hair transplant I got. And you're going to look at the pictures, it's going to look fabulous, and it's going to seem like it throws everything out that we're saying out the window. But for the general population, there are those people who have those results. But for the general population, yeah, you put a lot of time and effort and money into this, maximize your results.
Yeah. It's kind of like Red Fox. He said, look at all these health nuts dying for no reason. You know?
I can tell you this, that, you know, well, for me, I can't even understand like how people could still smoke. That's you know, that's really beyond. And there was a time in my life when I did smoke when I was much younger, but I grew up in a different time. Like I was a kid of the 70s and the 80s, so even though we knew the damage that it caused, you know, the whole Surgeon General thing was still relatively new. A lot of people just kind of blew it off. But, you know, there's just so many aspects to smoking that is beyond not cool. Everyone thinks it's cool. So there's a lot of young guys in the message forums that are still smoking, talking about whether or not their treatments are going to work, and they're concerned about having surgery and the fact that they have to quit smoking. Do you know anybody in your practice that continued to smoke after surgery?
Yeah, and you know what? It's very well proven that they don't have as nice a results and accelerates hair loss. It's really well documented. So, you know, some people can't quit. I once met a lady, she was dying of lung cancer, and she said, I will die before I quit. She loved smoking. And it's a powerful drive. So, you know, some people, they realize they're not going to get as great hair, and they're willing to put up with that outcome.
It's amazing to me.
So what your long-term plan is. If that's your long-term plan, okay, just don't fool yourself into thinking that you're not going to have hair loss.
Well, I have a question for you from the chat room. You know, a lot of guys use concealers like Dermatch or Topic. And
don't seem to have any acceleration of the hair loss.
Yeah, so there's no acceleration of the hair loss. But what about how long does somebody need to wait to start using these cosmetics after a hair transplant?
Wait until, so Greg will probably get a little bit of crusting afterwards. Wait at least 72 hours. And wait until the crusts are gone. It's usually about a week.
Okay, so you would say, to be safe, wait a week before you start painting your head again.
Yeah, some people are going right back to it because they have to go back to work and they need to camouflage or whatever. I'd say, okay, for that post-op day number 4, and today's post-op day 0, if you're counting. Tomorrow is day 1. Post-op day number 4, okay, you can probably do that, but I would tell people to avoid it. If they
also, what about you know, graft anchoring? I usually advise people, and again, those of you who are just tuning in, I'm not a physician, but I usually advise people that obviously they have to be very careful when they're shampooing for the first week, and about day 6 or 7, those grafts should be anchored. So whatever you see coming out doesn't mean you're not losing a graft. A lot of guys, when they see a little crust with hair in it, they think they're losing their grafts.
Yeah, they'll panic about that, and then they'll panic about swelling in the frontal area if they're doing something in the front. I got a text at 5:18 this a.m. about somebody. They woke up, or I guess early. I was up, but I have a newborn, so they're just freaked out about the swelling in the front of their head, and they freak out about the hair shedding. That's all a natural part of the process. It's all temporary. The hair all grows back.
Yep. A couple months later,
say that again?
A couple months later, you're like a chia pet. You wake up one morning and you're like, whoa, I have all these sprouts. They're all coming in. And then, you know, a few weeks later.
That really must be an awesome feeling, because, you know, I have never experienced that. I've been extremely lucky. I've maintained a lot of hair. I do some painting in the back. I talk about that all the time. I haven't undergone the process, but the guys that kind of, you know, who kind of understand the waiting game, once that growth starts to happen, especially if you haven't had hair in that area, it must be an amazing feeling just to kind of see that evolution, that you're kind of coming back to where you once were.
It is. My wife calls me her chia pet because it just starts to grow. And one day you see a bunch of little fuzz, and a few days later you see all this hair coming through, and after another month or so, you can actually integrate that new hair into the rest of your haircut.
Yeah, it's pretty
It's
amazing. Hey,
more
listen,
expensive for a lot of patients.
we
Oh,
actually
thank
do have a
God.
phone call.
Go back.
We actually do have a phone call, so let's see if we can get this through to you guys. Hey, man, you're on the air.
It's Josh. How are you?
Hey, Josh, what's happening, man? How you doing?
I'm doing great. I'm sitting here working, and I turn on the feed to see this, and it's just like blowing my mind what I'm seeing and what I'm like learning about the whole process.
Oh, man, I appreciate the call. We're having some sort of weird buzzing here. Let me turn this down a little bit. Turn down this gate. Okay, go ahead.
Wait, hello? Catherine?
Yes. Now let me ask you
yeah,
guys.
so,
Can you hear the caller?
Yeah.
Yeah.
Okay. Good.
Okay. So yeah, I just called and I wanted to ask, like, before you decide to go like this forward, like, do you sit there and weigh the pros and cons, or is it something you months ago to do it, and then you get the courage to do it? I mean, how long does it take to go through something like that?
Well, first of all, dude, are you calling from your cell phone?
Yeah.
Yeah, it's really breaking up.
Oh.
Ask the question again.
No, so I want to know, like, is the process the surgery? Do you sit down with a list of pros and cons? Did you make the appointment and then schedule? How did that go about?
All right, so you broke up a little bit. So let me see if I can get the question. So basically, you're asking before surgery, what goes through your mind? Are you sitting there with a list of pros and cons? Do you, is there and is that basically the question?
Yes.
Okay.
So I didn't have a whole lot of pros and cons to worry about. So just by way of background, when I was a kid, I was, your normal kid playing with your friends and your brother, and had fallen down, had scars all over my head. And by the time I got to high school, I decided to shave my head and realized I had one of the ugliest noggins I'd ever seen. And I don't know if you guys can see, but I naturally have lots of moles, and they're all over my scalp too. So I started growing my hair back out, and then in 2007, I had a friend from Maryland who was also an attorney and a bodybuilder who had melanoma that started with a mole on his scalp and spread to his brain and his bones and his lungs, and he died, and he left behind a wife and a 2-year-old girl. And so from that point on, I was religious about getting my moles checked, just from having spent so many years in the sun with no sunblock and a shaved head. And so I started going to a dermatologist and getting checked every 4 or 6 months to make sure everything was fine. And because of my risk factor, they decided they went ahead and just would be ultra conservative and started removing things. My hair had grown back by then, but I just thought, if my head was ugly before I had all these moles removed, it's going to be really bad now. And so as my hair started to thin and I could see those things underneath, I was kind of like, you know what, this is something I need to get fixed because it's kind of ugly now. And so that was my, wanting to get this done. But in terms of apprehension or worrying about it, it's cake.
Well, Josh actually hung up. He's having problems with his phone, but thanks for calling. I hope that answered your question, man. And yeah, I think everyone has their own reason, their own reasons to, go through with any cosmetic surgery. And it really depends on how, what you want, what your expectations are, and how, if you believe you're going to feel comfortable in your own skin without hair. And if you're not going to feel comfortable in your own skin, you're going to have to figure out what direction you're going to go into. And I think that, surgical hair restoration for the right candidate who understands, and I'm going to repeat myself, the entire scope and possible pitfalls of the surgery, and even the fact that, in some cases, things just don't go right, even in the best hands. If you go in knowing exactly what, all the possibilities are, then I think for a lot of guys, it's a great decision. But I am of the belief, and I tell people this all the time on my broadcast, that surgery is a last resort, that you really need to know what you're getting involved in because it is a commitment. It's not in most cases, it's not a one-shot deal, as Greg will attest to. This is his second procedure.
Right. And one thing that a lot of guys are afraid to give up is the ability to shave their heads because they're going to have a scar and everyone will know, oh, he must have had hair transplant surgery in the back because of the scar. Well, that was never really an issue for me because my head's so ugly, I would never shave it again anyway. So I was happy to get this done.
And you ask a guy who's like, well, I want to be able to shave my head. And then I say, well, have you ever shaved your head? And they say, no, but I want to be able to shave it. And often it's kind of they're not actually losing something. It's more that it's the idea that they might lose something. So it's not a tangible.
Yeah, they're concerned about not having that option. They're concerned about, well, what happens if I do want to shave my head one day? And I always tell people, well, if that's really the way that you're thinking, then maybe you're not a candidate for any type of surgical hair restoration.
Right, right.
Well, Spencer, I'm gonna give my patient a potty break.
I need 2 minutes. I'll be right back.
All right, great. You know what? So we're going to take a quick break. We are probably only going to go about another 10, 15 minutes. So,
Okay.
So when you get back, you'll be doing some recipient sites. You can kind of explain to people what you're doing, and then we're just going to say goodbye to everybody and wish you guys the best of luck. And Greg, you have a long day ahead of you.
I do, but I'm looking forward to it. Thank you, Spencer.
Awesome. All right.
Let's take the break.
How are you feeling?
That feels great.
Okay.
Let me get these wires out of your way now.
Did
Now-
my reverse head hit you too hard? Steph?
Now, are you done? Are you done with all the recipient sites?
No, I'm on about 300. Actually, 247. But who's counting?
You know, I'm just thinking, while instead of us taking a break, I mean, can we kind of see what's happening with your staff as far as dissecting the strip?
Totally around.
Hold on one second.
So as I'm going, Spencer, I'll just say this out loud. As I'm going, people will see me make a little mark on my glove. I'm counting the individual, how many holes I'm putting in Greg's head, so that he doesn't end up with a hole that doesn't have a graft in it. And my staff you'll see this as soon as he starts to pan, but they are counting every single individual graft. They're categorizing whether it's a single, double, or a triple. They are writing all of that down. They're very meticulous people. They are some of the best people on the planet in terms of being meticulous. And you'll see them calculating, and we do that for every single graft. So at the end of the case, I can tell you exactly how many hairs we have, how fast everybody was separating out the individual grafts, how many of each single, double, triple we have. So that's what my staff are doing right now. And these ladies are the best.
Now, how many people are actually dissecting? You have about 3 or 4?
We have 5 people dissecting.
We have 5 today.
Awesome. And just to explain to the guys who are just tuning in, they're using microscopes to dissect follicular units and cut around the grafts completely. Now, you guys, obviously, you're not cutting to size. You guys are cutting out pure follicular units. And for Greg, I mean, does he what is he averaging? What does he have? A lot of 3s, 2s? Does he have any 4s that you guys have been able to find?
So from his last surgery, he had a nice distribution. He does have 4s and 5s. He's got a bunch of little clumps. Since we're working in the hairline, we're definitely very interested in how many single hair follicular units he has. In his previous surgery, one of his single hair follicular units turned into a 2 right at his hairline, which drove me absolutely nuts. I can't even tell you. I have stories about that kind of thing. It's very rare for that to happen, but every once in a while it does. We do not transplant 2s in the hairline, and I can even show you the reason why. We'll see if we can pan in real close. But it drives me nuts. Yeah, you can see it.
You remember that, Greg?
What?
Water?
No, I'm fine. Thank you. I'm going to see how
Some
to
blanket?
back.
pee again otherwise. Where does this go? Here?
Underneath your knees.
All right.
All right.
Do you need a second one?
No.
You need a blanket?
No.
You need a shot? Just kidding. No.
I'm happy.
He'd like to drink, not to.
Oh.
I've done plenty of shots.
Well, since you've asked.
When I think amazes a lot of guys who really haven't done a lot of research on surgical hair restoration. The fact that Greg is just moving around, he's able to get up, using his own power to go to the bathroom. He's able to speak to us during the procedure, even though he basically had a strip of tissue removed and then his scalp sutured together. I think that surprises a lot of people. And that's why I think that these live streams are important for people to see, because you can kind of see the comfort level of Greg. And, most patients are, and I have seen a few patients who really don't have a great threshold of pain. And even in the worst case scenario, it's pretty comfortable.
Yeah.
It is. I mean, everything
Sorry,
from last time, I mean, worst case scenario, when I roll over at night, right on the donor area, it'd be a 4. I mean, and if that's the worst on a scale of 10 that you experience out of an entire thing, it's really not that bad.
So when you go home tonight, you're going to be sleeping propped up to some degree, right?
Right.
And so how is that? I mean, you've had that experience before. How is the first night?
First night wasn't too bad. You just kind of get a bunch of pillows, kind of prop them up under your legs. It's almost like sitting in a recliner. If you can sleep in a reclining chair, like a lazy boy, that would be a good way to do it. But I don't have one of those. So just, 3-4 pillows behind your back. What I really found helped was one of those travel pillows, the ones that are kind of shaped like a 3/4 donut that you put behind your neck when you're on an airplane. That really helped. And so you just have to make sure you sleep on your back to keep your head elevated, and that helps keep the swelling down.
So I don't know if you can pan in. I don't know if you can see this right here at the hair. Okay, it's behind the hairline just slightly, but there's a little 3 hair. It's very fine, but it bugs me. You probably can't get in close enough with that. There's a 3 hair follicular unit.
Want me to lean forward?
No, it's just the lens won't zoom in. That it's not a macro lens. So,
Okay.
Oh, this is like my worst nightmare. I can ask my husband. I have nightmares about 2 hair follicular units at the hairline. It's very rare, but every once in a while it does happen. And we're gonna hide that little guy today. He just has very robust follicles that want to grow. And they were very happy to be in a new spot, and so they just decided to celebrate by growing a 2-haired follicular unit instead of a single.
Having babies.
They had babies.
Well, and that's also, I have read about that, and I've seen, spoken to a couple of guys where, when they, I guess the hair is in a catagen phase, right? Yeah. So it's in a resting stage. And it's not necessarily visible even under the microscope.
Right. Exactly. And it's so frustrating. For people like me who want to control every aspect of this whole process, sometimes you can't control it. But it still comes out looking fabulous. So.
Yeah, so you are not one of the docs that you're not cutting ones to sizes. You are just working with whatever comes out as far as pure follicular units, or do you do cut some ones?
The only time I've ever had to do that is if I'm doing something, a very specialized case. Sometimes a hairline restoration, where I can only get out high number, like 2 and 3 follicular units, and you can't use a single or a 2 and 3 of the hairline. Sometimes brows, I have to do that. But it's rare. There's very, very few cases. And I just never do that because it decreases the result for the patient. The growth is cut, just like the graft is. And there's no way around it. It's very well proven. So chubby grafts survive better. It's just the way it is. Right. And if you want to get maximum growth for your patient, you can't do that. But I would say that that's a fallacy and a holdover from charging by the graft. Now, there's lots of ethical doctors who charge by the graft, but if you're a doctor who charges by the graft, there's an incentive to have lots more grafts. So
yeah, so since you're not, so you're not charging by the graft.
no, I charge by the I charge within a range. So it'll
Within
be
a range.
between this number of grafts. I just, in a case like Greg's, I get as many grafts as I possibly can. I do an estimate. I should know about how many I'm going to get. And in his case, probably around 2,400. And then I charge as a flat rate, and it covers everything in my practice, all your follow-up visits, all your meds, all your everything. So,
And that's actually pretty unique because, the way that the industry has evolved is, it was kind of, promoted and marketed as a commodity initially, the large chain clinics, and they started to charge by the graft because it seemed to be, like I said, it was marketed as a commodity, and maybe it appeared a little more palatable initially to the physicians, and also made it, kind of patients kind of understood what they were getting. I personally like the idea of the way that you're going about it, and there's a couple of other doctors out there that are still basically charging by the session. What does an average session cost? Say you do get 2,500 grafts or 3,000 grafts. What would an average FUT session cost?
12 for 3,000 plus.
Well, but an average. I think 7,800 is my total average, but it can range from 6 up to 12. I mean, it just
Which
depends
actually,
on.
in this world, it's in the world of surgical hair restoration, that is a very reasonable rate.
My husband says, "Don't call yourself cheap. I'm inexpensive, but I'm worth it."
Well, you know what? There's nothing wrong with that. There's nothing wrong with, if you're able to run your practice and you feel comfortable with the way that, the rates that you're charging, then, and your patients are happy with that, then that's the way to do it. I mean, it really depends on the practice. I know doctors here in Los Angeles who are charging $9 a graft. They're getting it, and they have happy patients because they're working with a very specific clientele. And then there are doctors who will, not in the IAHRS, but there are doctors out there who will charge as little as $2 a graft and promote that. And, I guess in some cases people get what they pay for. But, I think the way that you are doing it, if it works for your practice and works for your patients, I can see a lot of people being comfortable with that. Just kind of knowing what they're getting.
I read some, I think it might have even been on your website, but I read a blog once. It was a patient who was giving other patients some advice, and they said the number one thing is, to the extent possible, eliminate cost as a factor, because it's gonna sway you in inappropriate ways, and you're not gonna be happy at the end result. If you paid $5,000 for a hair transplant and it doesn't get you to your goal, what's the point? It's been wasted. So
I agree with that.
For considering that, yes, you need to have a budget, and it's fine to go around and see which doctors you like. And you can even use cost as a factor, but it should definitely not be your primary motivator. And if you can eliminate it as a factor, just wait and save. Get on Propecia, save your hair as much as possible. And this is not something you should go broke for.
Yeah, and I agree. There are people out there that I see who are willing to take out. There's nothing wrong with financing a procedure, but there are people out there who are. Hold on for a second. I just got a text. There are people who are willing to sell their car or put a second mortgage on their home to get surgical hair restoration. And I understand how desperate people are, but I think you're right. This is not something to go broke over. You should do it when you are in a comfortable position where you can actually afford it. And again, there's nothing wrong with financing it, but you want to make sure that you could afford that financing and feel completely comfortable undergoing the procedure and not just trying to get the cheapest price. That's why a lot of guys are traveling to Turkey, and there's some decent doctors in Turkey for sure, but a lot of people out there traveling to Turkey for $1 graft FUE or $2 graft FUE. And to be honest, I mean, what about aftercare? How do you if you're not close to your doctor, or at least in the same country, it can make things a little bit more difficult, even if you're getting a good procedure.
I've had experience where patients have gone to India and they've come back and they've said, you know what, I'm having a problem. But I don't know how to treat them because I wasn't there for their surgery. There's a lot of things that go on in surgery. I don't know whether they had antibiotics. They can't tell me. I don't know how many grafts they had. They can't tell me. It's it's unfair to go. It's like going to Ace Hardware, getting the advice, and then going buy all the stuff at Home Depot. That's not fair to the
Sure.
So the surgeon's giving you all the great advice, and then you go someplace else, but then you want them to take care of you. That, of course, I'm going to take care of you. I'm a doctor, but that's not cool, man.
Yeah, and I know it makes it very difficult. And I can't even tell you. We're going to actually have to close up shop in a couple of minutes because we have to go. And I think we've been running about 2.5 hours. But more people than you can imagine contact us after they've been to different parts of the world to try to get cheap cosmetic surgery, cheap hair transplantation. And they really, especially the younger guys, they really believe, okay, we see the online images. These guys are really promoting themselves and marketing well online. These guys are doing great work, just like the guys in the U.S. They go out there, they come back, and they are disappointed. And they're kind of panicked because, like you said, they don't even know what went on, what transpired in the OR. They don't know why they're having these complications. They don't know why they're having necrosis or whatever has transpired. And it is difficult for them they see another doctor. Doctors do the best they can. But if you don't know exactly what went down, if you don't have the ability to contact that surgeon yourself as a physician to talk about this patient's case, that's a big problem. And I really want the young guys especially to avoid that.
I know a bunch of surgeons across the world, and a lot of them are excellent. I can call those surgeons, but let's say it's somebody who I don't know or I don't speak Portuguese.
Right.
Or Thai, or how are we going to communicate in a timely manner to get this patient taken care of? You do put yourself at risk, which is not to say that those surgeons aren't fantastic. It's the distance that's the problem.
I agree with that. Listen, guys, I want to thank everyone for joining us today. I think that this was really a stellar event. And I certainly want to thank Dr. Sara Wasserbauer and Greg Adler for being a part of this, or for not just being a part of it, but, for letting us into the OR and sharing, Greg, sharing your experience with the world. We've had thousands of viewers who have checked in, a lot of people in the chat room, very interested prospective patients who I'm sure are very grateful for you doing this today. So, Greg, I want to thank you for doing this. And Dr. Wasserbauer, as always, thank you for your candor and for sharing your experience. And, listen, the truth is, a lot of people kind of find it difficult to hear the truth about, cosmetic surgery. They think that, it's going to be something that will, maybe change your life in one fell swoop. The fact that we had Greg in here who has had, going for his second surgery, I think it's kind of gives people a good education that, it's not always just a one-time thing with surgical hair restoration. Usually it takes a couple of sessions at the very least, and it is a commitment. So, guys, I want to thank you again for doing this. And Eric, man, thanks for running the camera.
Hey, my pleasure.
You're very welcome. Glad we could help.
Good
All
deal.
right, guys,
Thank you,
See you later,
We're
Spencer.
we're going to sign off. Hey, listen, Greg, have a great day. I wish you the best of luck. And I'd love to do a follow-up with you at some point.
Sure, absolutely. Be happy to.
All right, guys. Thanks a lot. Let me give out the websites, thebaldtruth.com. Of course, you can check out the American Hair Loss Association and AmericanHairLoss.org. We are live tomorrow night for our live broadcast of The Bald Truth at 8 p.m. Eastern Time, 5 p.m. Pacific Time. And also check us out on Sundays for The Bald Truth UK at 8 p.m. GMT time. So until next time, be strong, God bless, and thanks a lot for listening.